Welcome back to Community Conversations. I'm your host, Steve Mantis, and my guest is Matt Shaw, a local occupational therapist. So Matt, before the break, we were talking about how the shoulder is structured and quite an amazing physical thing there.
Yes.
As you know, I first met you because my shoulder was experiencing problem, kind of overuse syndrome,
Yes.
probably 15 years ago. I know for myself, it's hard to know when I might actually be injuring myself and what to do about it. What are some of the signs of problems with the shoulder, and what can be causing some of those things?
Yeah, Steve, first of all, shoulder injuries are very common, and they seem to affect all ages and genders, although there is a thinning of the tissue around the shoulder when you reach about age 40. So we're most prone to injuring our shoulders when you're hitting that age of 40 years and upwards. Part of the prevention, or the long-term prevention of shoulder injuries, lies in how you perform functional activities and being aware of what activities actually are stressful for the shoulder. So things where you're doing prolonged or forceful hand over shoulder types of activities is quite hard on the rotator cuff. It creates impingement in the cuff, kind of like you're putting your finger in the door jamb and shutting the door kind of effect. If you have any kind of weakness at all and you're doing things above your head or reaching behind you, will create, again, degenerative tears in the shoulder potentially. Any traction to the shoulder joint puts a lot of stress on the rotator cuff. So in our neck of the woods here, doing things like lifting up the back end of your snow machine creates great traction on the shoulder. And I think you have to be aware that as we age, there's a natural deterioration in the tissue. Mechanics, people who do work overhead, heavy equipment, mechanics for sure, but also housewives who are vacuuming, doing repetitive things with their shoulder where they're reaching, washing walls. Those kind of activities, day-to-day activities, are also hard on the shoulder. So knowing to keep your activities in close to your body, so you reduce that lever arm so you don't have quite the stress on that fulcrum of the shoulder. When you're lifting groceries, if you're reaching into the back trunk of your vehicle and lifting straight up with your palm down, that creates great force on the rotator cuff as well. And I think, in terms of prevention, again, shoulder pain is a warning signal, like on your vehicle, the red light going off. Pain in the shoulder is usually a sign of inflammation. If you have pain at night and you have difficulty sleeping, that's usually a sign of an injury to the rotator cuff or the bursal tissue or something else going on with the shoulder.
So I'm going around, my daily activities, many of which may be repetitive at work or at home.
Yes.
I'm starting to feel that pain at night, or, and I wonder, is it just I'm getting older because it's happening as we get older? Do I worry about it? What do I do when I start feeling that pain, or if it interferes with my sleep?
I think the worst thing you can do is try and work through it. Again, pain is a warning sign. You wouldn't drive your vehicle with a warning light on for too long, because that's usually a sign that something major is going on. So it's the same thing with pain in the shoulder. Usually worse at night when you're sleeping, but it can also be worse during an activity. The first line of treatment with that would be to rest it. Difficulty sleeping at night, again, is a sign it's inflamed, so anti-inflammatory medication that your doctor prescribes for you would be appropriate. Often you can take anti-inflammatories like you would for a headache, and that helps the inflammatory process. Icing when it feels warm to the touch, for instance, ice is a good early intervention, but soon after you would go to heat. So the idea of icing an inflamed joint is good in the initial stages, but then heat relaxes muscle tissue and stimulates blood flow to a greater degree than ice. If this persists for more than 2 or 3 weeks and you've changed your activities and you've tried to rest it and you've iced it and you've heated it and you've taken anti-inflammatories, the next step would be to consult your family physician. Occasionally the pain is unbearable. I've seen patients with acute injuries to their shoulder, or they've pulled it, there's a traction-like injury, or they've had a fall, or they've been playing hockey or chopping wood, where they've had to go to emerge because the pain can be 9 out of 10 pain. In that case, the emergency physicians prescribe sometimes narcotics or injections, steroid injections to help with the pain.
So, as you say, one of the first things is to rest it.
Yes.
Now, of course, your shoulder, when you do anything, your shoulder's involved, almost,
Yes.
except walking, I guess.
Yes.
So how do you really do that? How do you really rest it? Or is there some in between that you can lower the demands on the shoulder while still performing the things we have to do every day to keep life moving along?
Well, one of the things, we tell people while you're resting this injury is to use your opposite hand to help out. And that sounds like something that is a no-brainer, but occasionally people feel like they have to work through an injury and it'll get better with time. But to rest it would be to avoid things above your head, avoiding reaching behind. Maybe, don't vacuum the whole house all at once. Do one room at a time and compensate that way. Of course, in your situation, you have, that's difficult for you to rest that injured arm. And that was the dilemma that you and I had right from early on, was how to treat your shoulder, but not take you out of all your activities of daily living. And you're chopping wood and, you're working on a keyboard and mousing and doing things that often aggravate the shoulder. And that becomes a challenge.
Mm-hmm. And in terms of, when you go to work, you're paid to do a job that is oftentimes repetitive, whether it's on a keyboard or on the assembly line or in the hospital helping patients. How do you negotiate that?
It's such a common injury now, I think, with our aging population as well, our aging workforce. Shoulder injuries are so common that I think employers are more attuned to paying attention to symptoms with their employees, paying attention to what the therapist's recommendations might do in terms of work. Often workplaces now have modified duties for injured workers or employees who have, initial signs of injury. People know now in supervisory positions that if you're pushing, an injured employee, that ends up being disastrous in the long run. Often people who have to have shoulder repairs done surgically, if they're in a manual job such as nursing or mechanics or any of our other types of jobs like that, sometimes they can't go back to those initial jobs. So it pays to be proactive, practice prevention, and so I see more employers being more sympathetic to employees with those injuries.
We're going to have to take a short break. Please stay with us. We'll be right back.